Okay, so this morning, I think it's still morning, we're going to talk about dependent personality disorder. So for today, this is just informational information, and I just feel like it's vital in the times that we're living in that we learn about all these different personality disorders so we can help those that have them. And knowledge is power. That way, too, we have a better understanding. And isn't that what we should be doing, is understanding one another in the times we're living in? So a dependent personality disorder, that is a type of anxious personality disorder. And people with dependent personality disorder often feel helpless, submissive, and incapable of taking care of themselves. They may have trouble making simple decisions. And the condition is usually fixed with talk therapy. Some of the things, so these go along with borderline personality disorders. And it's an excessive need to feel like you need somebody else to take care of you. So they struggle with independence. They struggle with being able to do things on their own. This is also in the cluster C personality disorders. A lot of them are feelings of fear and anxiety. They are 1% of the population, and generally with women, not so much as men. But generally, these are inherited through women and sometimes at birth for some reason. Some of the symptoms and causes of dependent personality disorder. Someone with dependent personality disorder may have several behavioral symptoms, including trouble making everyday decisions like what to wear without constant reassurance or needing advice from others. Intense fear of not being able to take care of themselves, difficulty starting tasks on their own without somebody telling them that you need to get this started, or having extra support. They just struggle to make decisions on their own without somebody else valuing and telling them this is what you need to do. Doing other things that they struggle with is doing or volunteering for uncomfortable tasks to get support or nutrients from others. So they don't step up and talk to people about things. They need kind of guidance, and you're probably not going to be able to understand this about this unless you're close to them. Needing others to take responsibility for various aspects of their life. So a lot of blaming, it wasn't my fault, it's their fault. Avoiding and expressing disagreement or creating conflict in relationships for fear of losing the relationship. So people pleasers. These people are people that obviously have been traumatized throughout their life, and they tend to not like conflict, so they tend to do whatever somebody asks or wants them to do in order to not create conflict. Feeling uncomfortable when they're alone, so they need to be surrounded by people or around things. They just are not in a healthy space where they can be by themselves. Having a fear of abandonment and a sense of helplessness when relationships end. People with dependent personality disorder tend to interact only with a few people that they depend on. So they're loyal. They're loyal to a certain group of people, but you don't see them in large crowds with a lot of people. They're also more likely to tolerate physical and sexual and emotional abuse because they don't want to lose the relationship. So they bow down and allow circumstances and situations to occur that somebody else might not, just because they're more afraid of not being with somebody or being alone. What are some of the causes that cause dependent personality disorder? These disorders are among the least understood mental health conditions, but researchers think it's due to several factors, including experiencing abuse. People who have a history of abusive relationships have a higher risk of dependent personality disorder. So those that have a lot of trauma in their life, and they start out and maybe trauma from childhood in their own family, even childhood trauma, children who have experienced child abuse, including verbal abuse. And what we don't understand is I thrive on telling people and making sure, as parents, we break children's spirits when we cut them down, when we call them names, when we scream at them constantly. When we're doing these things, we are setting our children up to have some of these disorders because we're breaking their spirit. We're fragmenting them and not even knowing. So we have to watch that. Verbal abuse is a huge thing, and a lot of parents do that. And we just need to be more mindful about screaming and yelling at our kids in what capacity and the things that we're saying when we are speaking over them, because we're speaking things into existence upon them. Neglect it may also affect people who have experienced a life-threatening illness during childhood. So there's a fear, and I'm going to explain my grandma had a heart attack. And when she'd had that heart attack, what had happened was she then had this fear after having this heart attack. She was afraid to leave her home. She was afraid to leave her house. Her home was her safe haven. So that would be an example of a trauma that creates those people, gives them a sense of not wanting to leave their safe place because of that. And genetics. Some people with biological family members who have dependent personality disorder or another anxiety disorders may be likely to have a diagnosis of this. Certain cultural and religious or family behaviors, some people may develop it due to cultural or religious practices that emphasize reliance on authority. So an abuse of authority can cause people to bow down. I know that the first thing that's coming to my mind is the military way back, and I think even in Hitler's time, what they would do is they would tear down and strip people of self. And how would they do that? Tearing them down and just constant yelling and writing them with a strictness. And what this did was this stripped them of their self, and now they become so humble that they now would have personality disorders. And I'm reminded that a lot of these things happen through trauma, and what happens is their soul fragments to take on a personality big enough to protect the rest of the soul from actually dying off because of the abuse and trauma that they're going through. Some of the diagnosis and tests, how is it diagnosed? Personality continues to evolve throughout childhood and adolescent development. Because of this, healthcare providers don't typically diagnose someone with dependent personality disorder till after age of 18. Providers need evidence of these patterns of behavior or long lasting. So if you were to go to a counselor or psychologist, they would gather your history and they would look for patterns and how you tolerate and how you react to different scenarios and situations in your life. And by gathering information, eventually they would come up with the different personality disorders that you might be carrying or having. Mental health professionals such as psychologists, psychiatrists, suspect someone that might have a personality disorder often ask broad general questions that will shed light on their past history, their relationships, previous work history. Are they able to keep a job? And reality testing. Where is the reality? Do they live in a hallucinated state of mind, or are they actually in reality dealing with it? So a lot of times they have difficulty making daily decisions. They need others to be responsible for the most important aspects of their life. Difficulty disagreeing with others because they fear of that loss. Issues starting projects on their own because they're not confident in their own judgment and abilities, and a willingness to go to great lengths, like doing unpleasant tasks to get support from others. Feeling uncomfortable or helpless when they're alone because they fear that they can't take care of themselves. Urgently needing to form a new relationship with someone who will provide care and support to them, and then unrealistic worrying of being left to care for themselves. And I do think that we are seeing more and more of this personality disorder in our daily life today. Maybe you know somebody. Make sure you're reaching out with love and giving them the support that they need. And I hope this helps somebody. We'll do a different personality disorder tomorrow. And I say, go forth and be blessed. Be Christ, hands and feet, reaching the lost and sharing them with love. And I say this in Jesus' name. Bye-bye.